everyone, I am Arela, and for today's video, I am going to assess the upper extremities of the patient. Good morning, ma'am. I am Arela and I will be your nurse for today. May I know your name, please? Arela. Your age? 16. Okay, and your birthday? September 30, 2016. Okay. Ma'am, I'm going to assess your upper extremities. Is that okay with you? Yes. Okay, now you can now sit and be examined. Ma'am, the upper extremities includes only the part of your body, which is from your shoulder until your hands. So first is we need to inspect the skin color, tone, presence of lesions, masses, and texture. Also, I'm going to inspect the muscles for the size, contractures, and tremors. Also, the extremities for deformities. Okay, now I'm going to start now. Okay, now I'm going to palpate the landmarks such as the clavicle, acromioclavicular joint, coracoid process, bicipital groove, biceps and triceps, epitrochlear nodes, brachial pulse, medial and lateral epicondyles, olecranon, cubital fossa, radial and ulnar styloids, carpus, metacarpophalangeal joints, proximal interphalangeal joints, and the distal interphalangeal joints. Now I'm going to start in palpating all the joints. Now I'm going to check the range of motion of the client by asking the patient to do the following. Okay, ma'am. Now I'm going the range of motion. I'm going to check if you are able to move your upper extremities. Now, can you please sit properly with your feet on the ground? Okay, ma'am. Can you please put your hands in your lap, doing like that? Then move your hands above your head, just like this. Okay, then move it backwards until the back. Now, ma'am, we're gonna do the internal and external rotation. So for that, I want you to put your hands under your side. Then, in internal rotation, put your hands or move your hands to your front. Then across. Then move away in a 40-degree angle, just like this. Okay, thank you, ma'am. You can put down. Okay, ma'am, I'm going to test your resistance here. Can you please lift your arms in both sides like this with your fist closed? Then I want you to resist when I pull your arms up and down. Ma'am, now I'm going to check your resistance here. Can you please now, ma'am, I'm going to check your resistance here. Can you please lift up or lift your arms just in the middle? Okay, now I want you to resist if I ever lift your arms up and down. Like this. This is also for your resistance, and please make your hands in a flexed position and close fist. Okay. Now I want you to fight back when I push and pull your hands or arms to your shoulder, from your shoulder. Okay, I'm gonna push it. Okay, I'm gonna pull it out. Now, okay, now from a flex position, sorry, closing fist. I want you to put down your hands in a position which is this like this. then open it. I want you to do the flexing of your wrist, which is from up and down. You please flex your wrist from up, up, down, this is again for resistance. Can you please do the upward position just like this? Okay, and I want you to fight back when I pull them back. Can you please stand up first? Now I want you to resist or fight back when I pull down your hands. Okay, can you do this? Now again, can you please put your arms in a flexed position just like this? And do your combination position. Stand up. Then I want you to do the ulnar and now I want you to do the radial and ulnar deviation. It is pulling out and pulling in of your wrist. Radial deviation is pulling in. Then the ulnar is the pulling out. Okay, can you please pull in your wrist? Then pull out. Flex position again, huh? Like this. And please spread out all your fingers. And I want you to fight back again once I try closing your fingers. Okay, ma'am, in a flexed position again. Your hands are in formation, just like this. Okay, and slightly spread your fingers. I am going to check your nail bed capillary, which is this. this is the last part of our assessment. I want you to squeeze my hands in order for me to know if you are able to squeeze anything. Okay, now ma'am, we're done in assessing your upper extremities. Just a minute and I'll be right back to tell you all the results of your assessment. Thanks so much. Okay, so I'm done discussing the result of the assessment of upper extremities to the patient. Now I'm going to discuss it to you. First one is the skin color. The skin color is there's no redness or bluish color. So that is the sign that there are no bruises from her upper extremities. Second is the tone, which is tan, and there is no sign of lesions and masses. The texture is round. The texture of her shoulder or the patient's shoulder is round, which is the normal texture. Then the muscle size, which is also normal. And there is no sign of contractures, tremors, and deformities. So when it comes to landmarks, when I palpated all the joints and bones that included in the landmarks, the patients did not feel any pain, and there is no sign of fractures and deformities from the bones and joints. And when it comes to the range of motion of the patient's wrist, fingers, and arms were able to resist when I pull it out and in, up and down. Also, wrist, fingers, arms of the patient were able to flex. And when it comes to nail bed scapulary of the patient, it is normal, which is it turns white. Then after seconds, it turns into pink, which is the normal. Then when the patient squeezed my hand, she were able to squeeze it in a stronger way.